Hello, my name is Adele McFadden, and for my senior practicum, I research how to improve patient satisfaction surveys. Unfortunately, sometimes patient satisfaction surveys don't show the entire picture of the patient's care. During the beginning of my research, I decided to start with reviewing patient satisfaction over the past 2 years, noting that there were 4 specific topics that affected the score for patient satisfaction. Starting off is nurse responsiveness. This is important because the nurse is the one that will often have closer and more direct contact with the patient. Building a good relationship can help ease a patient's anxiety. Patients often reported feeling invisible during treatment process or when they were able to assist with their own care. Acknowledging patients and encouraging them to be involved in their own care promotes relaxation and a willingness to seek assistance and clarification. Quietness was the second factor that affected patient satisfaction scores. We all know that quiet and rest enhances recovery and promotes healing, but we also know that it's hard to obtain actual quiet in a hospital setting. Patients stated that they were often anxious to be discharged because even during designated quiet times, they felt staff were loud and they were unable to actually rest. Being mindful of quiet time in hospitals can help reduce stress and promote peace. Then we have the transition of care and discharge information, which are both crucial to maintaining continuation of care and decreasing a high number of frequent flyers. Healthcare providers should tailor their approaches to accommodate how their patients understand and learn, incorporating medication self-management, specialist follow-up, and acknowledging red flags that can detain or promote enhanced care transition. When delivering discharge instructions, making sure that the information is timely and easy for the patient to understand. It is very important that discharge instructions contain all pertinent information of diagnosis findings and how to support a patient when they feel everything may be overwhelming. Be receptive to what they have to say and take a few minutes to just sit and listen. Our profession is very busy, and sometimes compassion and empathy get overlooked. These are things that patients need to receive to feel like they are being heard. It will also promote them wanting to be more involved in their own care. Maintaining an active engagement with our patients can promote a trusting environment and reduce stress, improving patient satisfaction. Often, we get so caught up in the care that we are providing for these patients that we don't see them differently from medical and as a person. And when a patient feels like that, it gets lost in translation that we see them as humans, that we are human ourselves. Patients at night feel like when there's a quiet time, staff is often loud. So being mindful of a patient trying to sleep at that time, because during a day shift, there are so many activities that they have to do, whether they are going to get an exam or whether several doctors are coming in to see how they're doing. Just closing a door once or twice can help that. Another thing is making sure that a patient truly understands what they're being asked to continue once they are discharged. We are given patients a set of instructions, and patients will often nod and be like, yeah, I completely understand what you're saying, and have no clue because they don't have that trusting nature between us and them. So once you break down that barrier and have a patient understand, hey, I'm here for you, I'm here to benefit you, your care matters to me, they'll be able to feel like, okay, can you please answer this question, or can you break it down a little simpler so that I understand it better? Another factor is a high turnover rate with our staff. The problem with that is if a staff member doesn't feel like the environment is conducive to them, they'll leave. When you are working somewhere and you feel happy to go to work and your job is not just a job, but it's a passion, it's something that you enjoy doing and you want to do it, it crosses over into your care, and patients can see the crossover in your care and they're more receptive. So when working with staff, you also need to know, hey, what can I do that's different in my workplace to promote them feeling better so that when they're taking care of patients, the patient feels better. This all ties into one. Another thing is reducing patients becoming frequent flyers, which means them continuously coming in for the same thing. This also ties back into making sure that they understand their instructions, which also goes back into making sure that you've formed a connection with them. I believe sometimes also that care overall gets clustered. A patient can have a great experience in one unit and then feel invisible in another unit. So at the end of their stay, they're presented with these patient satisfaction surveys and care is just clustered. I believe that patient satisfaction surveys should be given on a unit base. Let the unit be evaluated. Let those nurses be evaluated for their care. You would see a big difference. You would be able to also tackle what the problem is and where the breakdown of care is. It's easy to change patient satisfaction surveys if we can see people better, understand them better, give them time to be better, and also just understand that we're taking care of someone's family. How would we want someone to take care of ours? Thank you for listening to me. Once again, I am Adele McFadden, and I hope this was helpful.